Acute myeloid leukemia (AML) is a type of cancer that affects the bone marrow and blood. It is characterized by the rapid growth of abnormal myeloid cells, which are a type of white blood cell responsible for fighting infections. AML is also known as acute myelogenous leukemia or acute non-lymphocytic leukemia. Here are some key points about acute myeloid leukemia. Symptoms. The symptoms of AML can vary but often include fatigue, weakness, pale skin, shortness of breath, fever, easy bruising or bleeding, frequent infections, bone or joint pain, swollen lymph nodes, and abdominal discomfort or swelling. Some individuals may also experience weight loss, loss of appetite, night sweats, or other symptoms. Causes. The exact cause of AML is not well understood, but it is thought to result from genetic mutations that disrupt the normal development of myeloid cells in the bone marrow. Certain genetic and environmental factors may increase the risk of developing AML, including exposure to ionizing radiation, certain chemicals such as benzene, certain chemotherapy drugs or radiation therapy for other cancers, and certain genetic syndromes. Diagnosis. Diagnosis of AML usually involves a combination of blood tests, bone marrow aspiration and biopsy, imaging studies such as X-rays or CT scans and other tests to determine the extent of the disease and its specific characteristics. AML is classified based on the type of myeloid cells affected and other factors, which helps guide treatment decisions. Treatment. Treatment for AML typically involves chemotherapy, which uses drugs to kill cancer cells or stop them from growing and dividing. Depending on factors such as age, overall health, subtype of AML, and genetic abnormalities, other treatments such as targeted therapy, stem cell transplantation, or immunotherapy may also be used. Treatment may be given in phases, including induction therapy to achieve remission, consolidation therapy to destroy any remaining cancer cells, and maintenance therapy to prevent relapse. Prognosis. The prognosis for AML varies depending on factors such as age, overall health, subtype of AML, genetic abnormalities, and response to treatment. Overall, the prognosis tends to be less favorable in older adults and in individuals with certain high-risk features. However, advances in treatment have led to improved outcomes for many patients with AML, particularly those who are able to undergo stem cell transplantation. Supportive care. Individuals with AML require comprehensive supportive care throughout their treatment to manage side effects such as nausea, vomiting, hair loss, fatigue, increased risk of infections, and other complications. This may include supportive medications, blood transfusions, antibiotics, growth factors, and other interventions to help maintain quality of life and optimize treatment outcomes. It's essential for individuals with symptoms suggestive of AML to seek prompt medical evaluation and diagnosis to initiate appropriate treatment as soon as possible. Early diagnosis and treatment can improve outcomes and increase the chances of a successful recovery.